Hi. A survey conducted by the prestigious American Society of Clinical Oncology reported a significant deterioration in professional satisfaction of the oncologists, with over 59% respondents reporting one or more symptoms of burnout in 2023 compared to 34% in 2013. Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow with a vision to find sustainable solutions. We hope to share our stories of wins, losses, resilience, and inspire and empower our community because we fly higher and longer when we fly together. Before we dive in, a disclaimer. The views shared on this podcast are an individual's and in no way are contributions from any institution, organization, or guidelines. For our session today, we have a wonderful friend and oncologist, Dr. Ruiling Yuan, who is a community oncologist practiced in a rural setting in South Carolina. In addition to a busy clinic, she is the Dyad Director of the Cancer Service Line at the South Regional Healthcare in South Carolina. She is in the board of South Carolina Oncology Society. She is the advisor at the Rural Cancer Institute and member of ASCO's Political Action Committee. She has been my co-fellow and close friend at the Baylor College of Medicine and has actually trained me to perform bone marrow biopsies. She loves to take walks and spend time with her husband and shop at White House Black Market. Dr. Yuan, welcome and thank you for being here.
Thank you, Jasmine. It's my honor to be invited talking to you today.
Wonderful. Ruiling, tell us about your practice.
I am a hospital-employed community oncologist. Majority of the time, it's largely serving rural populations. Mm-hmm. In my cancer center, I am fortunate to have a leader like Dr. Matt Logan, who is the CEO, who support us tremendously. Our cancer center growed over time. It's bring up some very specialized programs such as high-risk breast clinic, cardio-oncology clinic, and exercise oncologist, which is very good too for our patient who can receive this kind of services at home rather than otherwise they have to travel a long distance to get the service. I also fortunately to have a chance working with my colleague, Dr. Joanna Sadowski, who is a leading physician for clinical trials. Therefore, my center, even we serving with rural population, and we have built up a very sophisticated, complete, comprehensive cancer center. I'm proud to be part of that.
That is so delightful to hear. That even in the rural setting, you almost sound like you are very much in the metropolitan area because you're giving cardio-oncology, exercise oncology. So that is super amazing. Tell us, Ruiling, how having a physician lead in the CEO role for your hospital and health system has helped you bring in these services to your cancer center.
The organization who has a CEO who has a really knows from both sides, as a business mind oriented, but is a physician by training. So who knows the big pictures as well as know the details. Right. That is tremendously supportive for us building up a cancer center and expand to up to date is great in a very comprehensive. I'm so proud of him.
That is so exciting. It always helps when your leadership is able to understand your asks and requests because they have basically done the same thing or are still practicing medicine.
Exactly. And they listen. They understand.
Yeah. And that's the key. Listening is the key, because sometimes we as physicians don't do a great job being in the leadership roles because we're not trained and we don't listen. So
That's right. That's right.
yeah. So Ruiling, I know you have a super busy practice and you have somehow managed to still have faculty roles in different institutions. You currently have a faculty position at the Medical University of South Carolina and VCOM. How did you manage to get those faculty appointments?
Well, that is a great question, Jasmine. I probably already shared this with me. Actually, being an oncologist, this is my third career. I started as an assistant professor on a teaching track before transitioning to corporate industry research. And eventually, I found my way back to be an oncologist. So during this transition, one thing remains: my passion of teaching. You know, especially for nowadays, U.S. is facing a shortage on oncology practice.
Right.
By projection, about more than 2,000 shortage workforce at the end of this year. That is hit the most part in the rural oncology. Rural patient is really lack of access to get on-time care. Therefore, you know, I'm always thinking if the students, they are trained locally, they may stay locally. So for the students, if they are showing interest to the oncology services, I always say, come here. Let's work together. That is really for the way is to train them and get interested in, know how to work, and hopefully they can stay, especially in the rural settings.
What you're suggesting is that teaching is no longer an option. It's our responsibility. It's our moral responsibility. So we train the next generation of oncologists, whether they are fellows or residents or APPs, etc. Wonderful.
Exactly.
Ruiling, I want to circle back on what you just said. You said oncology is your third career. Please walk us through your, the steps in your career. Like, how did you come from China to the U.S. and how did all that play out? Because I think that's a very inspiring story.
So actually, after graduation, I just stayed in the university teaching, and I had a very happy life. But as you know, we always wanted to receive higher education. Once my husband came to the U.S., and of course, I came to join him, started research. Actually, in the university, the Pennsylvania State University, and there I got the chance learning microbiology, which is rewarding. And afterwards, that's the thinking of back into, okay, I wanted to be a teaching professor, but then with family, with my husband work, actually, there is pretty much no way I can do what I want. Therefore, after I graduation, I found myself sitting in the corporate research, which had a chance really working with stem cell research. That inspired me very much. Up to the point I said, I have research background. Why not I go back to medicine? Just to do whatever I can by unified to me together. Hopefully, I can do something different.
Wonderful.
So once my kids growing up, that's the reason I found my way, came back.
Wonderful. So you did your med school in China.
Yeah.
You came here, went on to teaching track and did research, went into the corporate world, and then came back to medicine as a resident and then did fellowship.
Correct.
That is awesome. Super inspiring. Thanks, Ruiling, for sharing. Dr. Yuan, you also have a clinical track faculty position at the Presbyterian College for the PA program, serving as a preceptor for the PA students, and also a clinical track faculty at South University NP program, serving as a preceptor for the NP students. How did you become preceptors for our nurse practitioner trainees, and how has your experience been?
So, good question. One again, for being an oncologist in the rural setting, first and most, you got to get the trust from the patient.
Correct.
They often ask you, why you come here? Are you not working in big city?
Right.
You must be not doing something well. That is between the lines. They always have the eyes on you and saying, well, why? Maybe you are not good enough. But then thinking inside, this is a trust, building trust is much more important. PAs, MPs, or advanced practice providers, they learn a lot from school. They learn through their clinical rotations how to taking care of patient. But what I think is very important is how to teach them to build up relationship, build up, gain their trusting. So that is something especially important in the oncology practice. Therefore, for any of the students, they are interested in oncology. Again, rather than just to sit there and saying, well, we are too busy clinic. Or we wish somebody come to help. But facing the shortages, but if they are interested in, why not? Again, trained locally, hopefully they stay locally. But one of the things is to teach them how to actually building up the relationship. I find this is very important.
That's so well said, because unless, we cannot just keep whining about the problems. And what you're suggesting is very much part of the solution, which is we need to train our PAs and NPs. And I so agree with you that building that rapport with the patient and that relationship for the trust and rapport is so important. Dr. Yuan, you've attended ASCO's Advocacy Summit for the last several years, and you are starting your term at the ASCO's PAC. You're also on the South Carolina Medical Association Legislative Delegate Committee. Tell us, why is advocacy important, and why is advocacy important not only from oncology perspective, but it's so important to partner with our medical associations, whether it's the national level or state level. Why is all of this so important? Why should I invest my time in this?
That is an extremely good question. I used to be an oncologist. After a long time, I'm focusing on myself to be a good physician, to get up to date with the current research science, refine my skills, just to get good care of my patients. But then over the time, especially heard about my 92 years old patient called me with advanced cancer, just saying, well, I might just die at home. I cannot afford to pay a big bill to be in hospice care. That is heartbroken. That is something, especially for our oncologists, we have firsthand knowing how important policy can shape and directly impact our patient care. So getting back to the advocacy on behalf of our patient, if I only have one voice, that is very small. Nobody can heard about that. But if we unified, that is how it's strong. And I've seen firsthand because of advocacy, the legislation passed the bills which directly impact the patient.
Mm-hmm.
A lot of issues like prior authorization reform,
Mm-hmm.
workforce shortage,
Mm-hmm.
can we get the research fund, clinical trial research funding? A lot of things really directly impact our patient.
Absolutely.
So I found this is really important. Advocacy is
Mm-hmm.
part of our job. It's
Right.
not it's something nice to have. To
Right.
be a effective oncologist,
Mm-hmm.
I think it's not only just being good, taking
Mm-hmm.
care of your patient,
Right.
but be always a advocate of your patient, getting their voice out to
Right.
the legislators before they make a decision,
Mm-hmm.
how their decisions can affect real world
Right.
cancer care. That is very important.
Absolutely. Yeah. No. And fortunately, we are part of all these organizations like ASCO who have made it so easy. And for our viewers and listeners, if someone wants to dive into advocacy, ASCO has made it so easy that you can literally log on to ASCO.org and go on to ACT Network and literally send letters and messages to your lawmakers with a click. So it cannot get more simple than that. Thank you, Raylene.
Yeah. So, to add on that, I
Mm-hmm.
feel like a lot of oncologists actually they are willing to do that.
Mm-hmm.
I'm glad you mentioned ASCO has made it easier
Okay.
because a lot of us we don't know. We
Mm-hmm.
want to help, but we don't know.
Mm-hmm.
Like me, really truly because of you, Jasmine. I'm
Oh.
coming up to the point is because you actually showed me the way how to get in. And before that, I even did not know what I should do as part of it.
Oh, thank you.
Yeah.
That makes me
So
very
on the
happy.
other hand, oncology itself is not, we're not practicing in vacuum.
Mm-hmm.
So oncology is actually involved in all the specialties,
Correct.
starting from primary care,
Mm-hmm.
oncology, cardiology,
Mm-hmm.
and surgery. Big time, general surgeon, orthopedics,
Mm-hmm.
vascular oncology, thoracic uh, surgery, every aspect, as
Mm-hmm.
well as pain clinic,
Mm-hmm.
palliative care.
Right.
So a lot of time, in Broadway, medicine is facing a lot of challenges.
Mm-hmm.
Again, workforce shortage,
Right.
expanding Medicaid,
Mm-hmm.
expanding, and how can we have a telemedicine prior authorization? Those
Right.
are the things if we can working with other broad organizations in
Right.
my state, such as, South Carolina Medical Association, or
Yeah.
even big national level like AMA, NCCN, all those, if we unified,
Right.
actually, hopefully, we can reshape the
Mm-hmm.
systems and so that we can provide better care. All at the end of the day, patients get benefit.
Absolutely. This is so true. Like collaboration and partnership is the key because we're not operating in vacuum, as you said, Ruiling. And a couple of hundred oncologists rooting for something versus a couple of thousand physicians rooting for the similar things, the impact is multiple, right? It multiplies when all physicians partner together. I so agree with you. Yeah. Railing, what would be one piece of advice that you would give to yourself of 10 years ago?
Here is a very good question. If I would tell the youngest me,
Mm-hmm.
I'm always afraid. Training as a physician, we are our own boss. We just take care of our patient, mind our business, and not even get outside. As I mentioned, that was me trying to focus in myself. And now I would give myself advice is just to put yourself out earlier. make those connections.
Right.
Never underestimate the advocacy. The reason for that is connection is very important. Making either in a state level, national level, even outside clinic, talking with colleagues, learning from peers.
Right.
Or we are not only helping with the career growth, actually in somewhat directly, indirectly affect my patient care. That
Absolutely.
is very important. At the end of the day, it's my patient who gets benefit.
Right. Absolutely. No, very well said. Thank you. Moving on to a little bit of fun part of the podcast. So a bit of rapid fire for you, Ruiling. What's your favorite book?
That would be Jason Bond series. You know, Jasmine, I do everything slow. I talk slow and I do slow, but I do love fast pacing novels.
I respectfully disagree that you are slow. You may talk slow, but you are actually a very efficient, fast worker. You're not slow.
Oh, thank you, Jasmine. Yeah, I love this book. It's like story keep you guessing ending part. It's intelligence. It's a really great escape for me.
Yeah.
Yeah.
Wonderful. Favorite leader for you?
I mentioned my CEO, Dr. Matt Logan, and he is my favorite leader. In many ways, he grew locally and came back as practice physician locally. Eventually found his way to become a CEO of our organizations. Under his leadership, our cancer center, really he support our vision, our regarding to a patient-centered care, and he listens. Here is the thing. It's very inspiring. You can learn and work fun with this kind of leaders who has a big picture, but also pay detailed attentions, which at the end of the day, benefiting for the patients and providers.
It is actually so gratifying to hear that your favorite leader is somebody who you work with and you have experienced his style and his way of working firsthand in real time, right? And so I feel like I want to talk to Dr. Logan now.
Believe or not, actually, my son, before he went to business school, actually got a lot of good advice from Dr. Logan.
Oh, that's awesome. That is awesome. Wonderful. What's your favorite cancer study, Ruiling?
Cancer study, there are many ways. In the past, I did a lot of research on stem cell research, particularly growing cells from umbilical cord. That was then my favorite thing to do. Now, my favorite study, actually, we just started. It's a study on exercise oncology. As you know, cancer patient, when they are on a chemotherapy, they get a tired sarcopenia. Again, working with Dr. Sadurski, we just revisit this subject, trying to get some data on the exercise oncology, get some really good short, can be easily adaptable for other part of for rural patient, working with rehab, Stephen, and his colleagues. We actually get something. At the end of the day, this is not only for quality of care, but also have impact for many after years. For them, that is very good.
Absolutely. Yeah. A lot of focus in oncology. I'm so happy that we are entering this era where a lot of focus in oncology is reducing drug toxicities, reducing over treatment, and improving quality of life by things like what you just mentioned, Ruiling.
Yeah.
Wonderful. What's your favorite restaurant in Greenwood?
My favorite restaurant in Greenwood has to be fusion Japanese and Thai.
Okay. Okay.
That is started, I like Thai food. This is starting our first time I met with you in the fellowship. You know how we started, we talk, we have big passion regarding to future what we do with oncology, and as at the busy time in the clinical rotation we got to study in service exam,
Right.
and the often time go to restaurant after a big long day.
Right.
Study is Thai restaurant.
Yeah.
So that actually brought my taste is never go wrong with sushi and Thai curries.
Yeah.
That is my go-to place always.
That's awesome.
Yeah.
Wonderful. Yeah, lots of memories there, right?
Oh, yes.
Yeah. Favorite hike in Greenwood?
I like walking in general, as you mentioned, and living in 96. It's a small place.
Yeah.
Now, a lot of people never heard about that. And me, just by visiting a 96 historical site, that is, to me, it's my favorite walkings. You know, lots of histories.
Yeah.
And as a resident in 96, I found out this is close to home. And if I need to go there's a place. Not big, small, but good enough for me.
You have to share a fun fact about yourself with us. I know you shared with me, but I will let you tell the story.
You know, fun fact, it's not expect for me. Most people may not even guess what I have done. Is I always thinking, you know how I heard moonlighting when I started residency. I always thinking moonlighting is just for medicine. But it turns out I moonlighted at our backyard. It's me and my husband building a sauna room. That is literally from scratch. We cut down trees, we make with wood, we build up with our own hands.
Yeah.
That is very rewarding. I always joking around, I get paid very well by looking at this project. And especially after a long day clinic.
Yeah.
That is my go-to place to get relaxing and recharging. That is really rewarding. That is my fun part about me.
That's so great. You have to send me a picture of that, you know?
Oh, yeah.
All right, Ruiling, last question for you. If you were to relive your life, would you become an oncologist?
Absolutely. Without a doubt. Oncology is filled with heartbreak and hope. And working with patient, what is most rewarding part is building up a long relationship with patients and their family.
Right.
That is the patient, once they trust you, their gratitude, their resilience, their trust in us.
Right.
It's very humbling. And I feel very honored by inviting by patients. They celebrate their cancer-free, reaching up milestones. All the patients really before they leave this world. Right. They tell their family has to call Dr. Yuan, let her know. Yeah. And then invited me to a welfare moments. Those are the things make me feel like I am walking alongside with them. I'm part of their journey. Yeah. Even sailing stormy seas, all calm moments, enjoy the life. Like my patients got a lot of chemotherapy treatment, and at the end of the day, miracle happened. Yeah. Beautiful baby delivered. Aww. That is a very joyful moment. To me, if it's coming again, ask me choosing, there is no way. I don't know what else I do. Even I told you I have 3 careers.
Yeah.
That is, I guess it's lead me to be here. I
Yeah.
have no any other way to go but oncology. Yes.
Oncology. Awesome. That is wonderful. Thank you, Ruiling. That was all. And 3 key takeaways from conversation with Dr. Yan. Teaching is part of the solution of many problems we are facing. And training healthcare staff, whether it's our medical students, residents, trainees, APPs, NPs, primary care physicians, sometimes even high school students or undergrads who want to come shadow us, is the key to solving the work staff shortages problem. So we cannot shy away from that. Collaborating with the hospital administration and nearby academic organizations is a must. And networking and advocacy are crucial components of practicing medicine in the correct times. Thank you to our viewers and listeners. This is Jasmine Kamboj and Dr. Ruiling Yuan signing off on behalf of OncoDaily from our conversation on Empowering Oncologists. Thank you.
Thank you, Jasmine.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.